Well, Sean and Monty, thank you again. So I'll go through a couple questions that have come in from the audience. One of them is a very quick one. How do you convince patients with a problem like third nerve palsy to operate on the so-called better eye?
It's hard.
It's actually been much easier than I thought it would be. Again, I've got pictures, some examples of the pictures that I use here, and we use those kind of pictures and show the patients the results. And again, when I was a resident, we would rarely operate on the good eye in amblyopia patients. Oh, it's too risky. And we've done so many of them, I don't worry about the normal eye versus the abnormal eye anymore. So I'm not concerned, and I have not had any problem convincing the patients.
I show them what happens when I put the prism over the fellow eye. You put the prism over, take a picture of it, and you show that the lid's up. And when I'm doing the versions and I point out to the resident the lid comes up, I also point out to the family, look at this eyelid, see how the eyelids come back up now. We're going to talk about that in a minute. And then I put the prism up, and it really convinces them nicely.
Saving them another surgery too, yeah.
Yeah, it saves them an eyelid surgery, right?
Yeah, Sean, just a very specific question for you. In the cases that you showed, were the medial rectus resections done with lateral rectus extirpation?
Yes, yeah. I typically did 10 to 12 millimeter resection of the medial rectus with that extirpation. Yeah, I did not do the extirpation alone. I always combined it with as much of a tightening procedure as I could.
And one very specific question, actually a couple of very similar questions came in along these lines for Monty. For the type of interventional surgery that you demonstrated, can you just comment on if it only works if the fixing eye is a non-paretic eye?
If the fixing eye is, yeah. I guess I don't think I've ever seen one in that situation that wasn't fixing with his normal eye. So I guess I don't know, but I would think it would be more difficult. They would have to use some kind of an anomalous head posture if you didn't get the eye all the way over, either left or right.
And if the lid's down, they really aren't able to fixate with the paretic eye. So I think most of the time they're going to be, at least in my experience, have all been fixating with
Interesting,
paretic eye.
because I've never seen one that fixed. Whereas like inferior oblique palsy, they very frequently fixed with the palsied eye, but not in third nerve palsy.